Good morning. My name is Susan Kanatibuck. I'm a nurse practitioner. I'm from Newark, Delaware, and I'm delighted to be here at the AANP conference this year. It's been a very interesting, wonderful conference for several reasons. One, we started a new SPG that's for healthcare informatics and also for telehealth. And I wanted to talk with you and just to let you know, to make sure that you understood how much healthcare informatics is important in our world today. We are facing a time when there are many things that are making us practice, maybe not the way we learn to practice, but with value-based care and value-based medicine, as well as consumerism or the patient's role in helping them help themselves. It's very important that we have opportunities to be able to help them with what they need to know, as well as to help ourselves be able to practice more. I often say information today comes to us like drinking through a fire hose. There's so much we can't keep up with it all. So there are many things that are helpful that are involved with healthcare informatics that may help you and help all of us to be able to practice better. I was reading a very large, well-known person who speaks on healthcare informatics last week who mentioned that there were some fields where there wasn't much going on in healthcare informatics, and he mentioned nursing, which kind of took me back a little bit, because we have many things that are happening in our field today where nurses are involved in healthcare informatics. We certainly are learning to use and sometimes love, maybe not always hate, our EHRs, but we also have many other things that we're interested in these days. Certainly, of course, we've talked about telehealth is becoming a very important part of our practice, but there are many other things that are helping ourselves and patients, such as virtual reality. Things like artificial intelligence is a very important part of our work that's getting stronger, and it's not going to take over our world. We'll still have careers after that. But it's important that we recognize that there are technologies that help us with genomics, in healthcare informatics technologies that help us with, again, helping our patients to help themselves in terms of using things such as apps. You have to realize that when you prescribe an app to a patient, it's important that they realize how to use that and how to use that effectively so they are able to help themselves. But the big news is that there are many opportunities for us to grow and learn, to expand our practices. So if you hear about things like artificial intelligence or the use of apps and you feel like, I can't do that, that's so far out of my bandwidth, it is probably now, but it's going to be coming soon to your practice. So I encourage you to research, to learn some more about it. There are, again, in the field of genetics, in personalized medicine, all of those things are coming to us, and it will help us to be able to provide better care. You know, we're in this world of value-based care. We also are in a very competitive market because it's not just us as healthcare providers and the patients. Now there are other players in there, such as companies that get involved also with trying to help patients help themselves. And so anybody who has a smartphone has an application that helps them help their health. We have competition, or you could call it competition, or you could call them assistance, coming from other places like different pharmacy companies. We also have even places like Walmart, and so it's important to realize that there are other players in the industry. Again, not that we have to be in competition with them, but we have to look at how do we use them most effectively to be able to help our patients, help ourselves. You know, at the end of the day, I think we all have the same goal, which is to go home and say, I really helped my patient today. And so I'm encouraging you to think about broadening your thinking about healthcare informatics, and maybe taking on one particular thing that you did not know about and perhaps looking at that. I'd also like to mention one thing that's really important in our world today, which is cybersecurity. There are tremendous numbers of people who are getting their information hacked, and when that happens, it makes the patient feel very insecure because now suddenly someone has all their healthcare data. And for us as in practitioners, the problem becomes extremely important in our practices because it's so incredibly expensive for us to pay the fines, not only to our state and to the federal government, but also for all of the things that we need to do to help the patient feel secure, such as buying them security in terms of their data protection and their finances for about 3 years. Very, very expensive. And again, it's one of those things that we can really help ourselves and our patients by making sure, as boring as it is, to read through all of those things you agree to before you decide that you're going to purchase an app, or you're going to, even a free app, allow them to have access to their data. But cybersecurity is a very, very concerning thing. So whatever your company is recognizing that you should do with it, whatever your technology is, please make sure that you're using encrypted data. But you're also, if you're doing anything about sharing data, make sure that it's going to a secure site. And please make sure that you're aware of what the company regulations are to be able to practice safely. Again, it's not a day goes by that we're not getting 3 and 4 cases of people have had their data stolen. And it's not just 1 or 2, we're talking about millions of people. So the goal is to basically make sure you're protecting yourself and protecting your data. And at the end of the day, you're protecting your patients. So please pay attention to cybersecurity and don't think, it couldn't happen to me, because unfortunately it happens to all of us. I mean, I personally have had my personal data hacked like 7 times, but I don't know whether that's because I work in the industry, somebody's after me, but it is even for personal, but your healthcare data is very attractive to data thieves because it gives them access to their credit information, it gives them access to their health information, but it more importantly gives them information to sometimes even their family health information, and that can be looked at as a long-term investment for a cyber thief, because they can see what kind of diseases and problems a person has as well as their family, and perhaps reach out and not touch them in a good way, but perhaps for blackmail. So again, the cybersecurity is extremely important to healthcare, and you should never think it will never happen to me or my practice, because unfortunately it probably will at some time in your lifetime. So again, that's my message. I am so delighted that AANP has started this SPG on healthcare informatics and telehealth. We are making great strides in telehealth to be able to practice effectively. We're looking at publishing some information within AANP's website so that you can get more information about how you can become a telehealth practitioner, because in many cases, even in your smaller family practices, you may be seeing an influence of telehealth in the future. But take advantage of all these things. Don't think that technology is this big evil thing that's out to harm you. It's not. Try to think of it as something that will help you to help your practice. We're all trying to see as many patients as we can and see them effectively. And value-based care requires us now to provide care that will actually enable the patients to get some great value from that. And so it's important that we look for all opportunities to be able to help them. But remember, you're also trying to help yourself, because remember, on that quadruple aim, we're trying to make sure that the patient is secure. We're trying to make sure that we're giving good care. We're trying to make sure we're giving value care. But remember, that fourth part of that quadruple aim is us, the practitioners. So you need to start taking care of yourself in doing this and thinking of smarter ways. And sometimes doing that takes a little bit of work to try to understand how to be better at doing that. So I'll sign off here, but I wanted to say thank you. I've had a great conference here. It's been my pleasure to meet many of you. And as I said, if you have information or interest in joining the healthcare informatics and telehealth work group, we'd love to have you. And feel free to email me if you have some questions. I'm listed on that site. But there are many, many wonderful SPGs, and so I encourage you to take a look at those to help you extend your knowledge of whatever area of interest to you. Thanks so much for listening to me, and I hope you have a safe travels home. Hope to see you again in the future. Thanks. Susan Kennedy Buck signing off. Bye-bye.